Hello and welcome back. If you just finished up the reproductive system with the male reproductive system, we are now on female reproduction. So let's just go ahead and get started. Here we go. All right. So, female reproduction. As I had noted in the last video about male reproduction, the functions of both reproduction systems are the same-ish. Um, in the female, it is to produce the egg. Male, it is to produce sperm cells. Both transport and sustain these cells. Both produce and secrete hormones, different hormones, but hormones. And in the case of the female, one of the functions is to nurture the developing offspring. Gonads, of course, are just the primary reproductive organs of each system. Ovaries and females, testes and males. The ovary, of course, is to produce egg cells. That's its main job. Testes are to produce sperm cells, and then, of course, they both produce hormones. There are secondary reproductive organs in both systems, which are basically just all the other organs or ducts or glands that either transport or sustain the gametes, which is what the cells are. All right. As always, if you have not already, please subscribe to the channel so that I can keep doing what I do. I really enjoy this, and it does mean a whole lot to me. And click a like if you haven't already as well. And we will go ahead and get started. All right, so female reproduction. Um, the system that females have for their reproductive system produces and sustains female sex cells. These are egg cells, or what we call ova. It also transports the ova to a fertilization site, which we will talk about. Provides a more favorable environment for the developing offspring, moves the offspring to the outside of the body at the end of the development period, and also produces female sex hormones. So it works a lot of work, a lot of work. All right, so the primary female reproductive organs, as we had mentioned, are called the ovaries. Okay, ovaries are solid oval structures. They are located on each side of the uterus in what is called the ovarian fossa. It's like a little depression or a little dip. And they are held in place by peritoneal ligaments. This is a drawing, of course. So here is our ovaries. We have two of them here. Okay. Um, that's that depression I had spoke of. It's hard to see on a drawing. And then this whole area right here is a ligament, the peritoneal ligament. Kind of looks like a fanned out piece of tissue that holds everything in place. Okay. We will talk about these other structures here in a moment, but just to kind of get, an idea of where everything is situated. The structures of the ovary are the tissue that covers the outside of the ovary is called ovarian epithelium. There's then a dense tissue underneath the epithelium called the tunica albuginea. The outer layer of the inside of the ovary is called the cortex. This is where ovarian follicles live. This is also what contains the oocyte. Yes, it is pronounced oocyte. I love saying that. Which is the female cell or the egg cell. Inside or the inner layer of the ovary is called the medulla. You're going to notice as you go through, if you haven't already gone through all of these, or if you just don't remember from when you did go through A&P, there's a lot of cortexes and a lot of medullas out there, just saying. The medulla of the ovary is where the blood vessels and lymphatic vessels and nerve cells and nerve fibers are contained. So here is a picture. This will all come in to play here in a moment, but this is the ovary itself. Um, and these are all those follicles that it contains, which we will be talking about in just a moment. Okay, so if you've watched the male reproductive video, you are aware that the production of sperm is called spermatogenesis because it's a sperm cell. The egg cell is called an oocyte. So guess what? The production is called oogenesis. No joke. I love that word. Yes, I'm a medical nerd. This starts really early in fetal development. Okay. The germ cells differentiate into what is called oogonia. What happens is these divide to form cells with 46 chromosomes or 23 pairs. They enter into a phase of growth that then causes them to become primary oocytes or egg cells. They replicate their DNA. They start to go through their first meiotic division, and then it stops. Okay, now if you think back to high school, probably high school biology, science, um, or if you're a fan of the Twilight series, um, it's so sad that I can even admit to that. There are phases in cell division. Okay. Now, there's meiosis and meiosis, right? There's telophase, prophase, metaphase. Okay, I'm sure you remember all of this. Hopefully, or it was a bad dream, and maybe it sounds somewhat familiar. When that first meiotic division begins, it doesn't continue during this part of development. It gets into the prophase portion and then it stops and it just stays kind of suspended there until puberty hits. So for quite a few years, it is in that particular phase and just stops. Now, ovaries contain, at this part in fetal development, baby childhood, about 700,000. Yes, let me say that again. 700,000 primary oocytes. That's what you have at birth, ladies, okay? Females. That's it. That's the lifetime supply. You're not getting any more, okay? By the time puberty hits and this whole division phases start to happen again or continue rather, there's about 400,000 left. Now, keep in mind, if you go back to male reproduction, they have millions upon millions upon millions upon millions upon millions of sperm. Okay. And there needs to be many millions of sperm statistically to get to that one egg. Okay. Females only need the one egg for fertilization to happen. So 400,000, even a decrease of 300,000 eggs or oocytes is not a big deal. That's way more than necessary for a lifetime. Okay. At puberty, several of these primary oocytes grow each month. Okay. Now, again, it's not that just one happens every month. One makes it every month, but several of them start to grow. Okay. But still, 400,000. We got 400,000 of these. That's fine. One will outgrow the others and will resume meiosis. If fertilization does not occur, that secondary cell that resumed will just die. It'll just degenerate, as will the other primary oocytes that were outshined basically by the one that outgrew them. Okay. It's all of this is it's a race, it's a competition. All right, so back to this particular diagram. So this is ovulation. And what happens during ovulation is you've got the primary follicle, primary ovarian follicle within the ovary. Okay. That's where the primary oocyte is. That's right there, a little purple thing. Okay. It then becomes a secondary follicle, still has a primary oocyte. Okay. It gets bigger, becomes a tertiary ovarian follicle. Okay. With what we call granulosa cells. It gets even bigger and fluid starts to fill the area. This is now the mature ovarian follicle, which contains the secondary oocyte. And then as it makes its way here, basically there's just a bursting open of the follicle, and it basically just spits out, for lack of a better term, the egg cell, the oocyte. Okay. That is ovulation. And that is when the cell or the ovulated secondary oocyte is picked up by the fembrae, which we'll talk about in a minute, and basically ushered in to the uterine or fallopian tube so it can be on its way. Now, what happens after that is spit out? You still have this follicle here. The follicle then turns into what is called a luteum. Luteum, if there is fertilization that happens, that will start to secrete various hormones and substances that will aid in the growth of an embryo. If not, it will just turn into the albicans right here that will basically just stop everything, degenerate after a bit, and it'll start all over next month. Okay, so that is ovulation. Just talking about the uterine or fallopian tubes. These extend from the top portion of the uterus to near the ovary. They do not have a direct connection. They are not connected to one another. Even though in most of these diagrams and pictures and stuff, it looks like they're connected to each other, they are not. There is a space. The uterine or fallopian tube ends in finger-like projections called fimbriae. That's these little guys here. The fimbriae basically allows for the oocytes to be swept into the fallopian tube. So it's kind of doing a brushing motion, so to speak, and it kind of sucks them up in there. Once inside the tube, the oocyte is moved along towards the uterus, and that journey generally takes around 7 days. The oocyte can only be fertilized. It has a window of 24 to 48 hours. If it is not fertilized in that 24 to 48 hours, we missed the window, it's over, got to wait till next month. Okay. Fertilization does usually occur in the fallopian tube. So that is where the sperm has made its way to. Hopefully by that point, it will meet up with the oocyte. Fertilization will occur and it will continue into the uterus. Okay. Here's the uterus. Uterus is located in the pelvic cavity. It's a muscular organ that provides for the developing offspring. It's about the size of a pear prior to the first pregnancy. After the first pregnancy, it gets a little bit bigger. But then after menopause, it gets smaller again, basically because you just don't need it anymore. The wall of the uterus is made of three layers. You have the perimetrium, which is the outer layer here. You have the myometrium, which is the middle muscular layer, which is made of smooth muscle. And then you have the endometrium, which is the inner layer that is made of two different stratums or layers. One is called stratum functionale, which is sloughed off during menstruation, and then stratum basale, which rebuilds the stratum functionale after menstruation. Okay, so there is your uterus. The top of your uterus, just like with the stomach, is called the fundus. This is the body of your uterus, and then this is the neck of the uterus, which also contains the cervix. Okay, the vagina is a muscular tube made, of course, of smooth muscle as well that is capable of stretching, and it extends from the cervix to the outside of the body. It functions as a passageway for menstrual flow. It receives the penis during sexual intercourse and also serves as a birth canal. So many, many jobs the vagina has. As far as external genitalia goes, there is the labia majora, which is basically two just fat-filled folds of skin that encloses the external genitalia. Because remember, unlike males, females' genitalia is all basically inside. There's just a little bit on the outside. The mons pubis is the rounded elevation of fat that covers the pubic symphysis, or the front part of the pubic area. The labia minora are two smaller folds that are medial to the labia majora, or just inside, basically. The vestibule is the area between the labia minora. The clitoris is a mass of erectile tissue that's located at the end of the vestibule. It is the same erectile tissue that the penis has and that the nipples have. It is just not the same size, obviously, but still can become erect when engorged with blood. The prepuce is a foreskin, basically, but on a female, it's just a tiny little fold of skin that covers the clitoris. The periurethral glands open into the vestibule next to the urethral opening, and these secrete mucus. And the vestibular glands, or what are also known as the Bartholin's glands, open into the vestibule next to the vaginal orifice and secretes mucus during sexual organs to act as lubrication. Here is a diagram of all of those. So you have your labia majora, labia minora. So the pink is the majora, the blue is the minora. The vestibule is the green area here. Here is your vaginal opening. Here is your urethral opening. Here is the clitoris. On this diagram, it calls it the clitoral hood, but that's also the prepuce. The mons pubis is this area right here. And then just for positional purposes, this is the anus. So that would be the laying on their back view. As far as female sexual response goes, blood flow increases to the clitoris, the vaginal mucosa, the breasts, and the nipples in response to a sexual arousal. Glands in the cervix and the vestibular glands secrete fluids to lubricate the vagina. Continued stimuli then culminates eventually into orgasm. And during orgasm, rhythmic contractions of the uterus and the pelvic floor muscles help to kind of move the sperm up and through the uterus and into the fallopian tubes. All right, so the menstrual cycle. This happens every month due to changes in the endometrium, or that inner layer of the uterus. During the menstrual, there are phases. During the menstrual phase, which begins on the first day of the cycle and lasts for about 3 to 5 days, everybody's different. some a little shorter, some a little longer. Um, the outer layer of the endometrium, or what we termed the stratum functionale, detaches from the uterine wall and passes out of the body through the vagina, and that is what we term menstrual flow. During the proliferative phase, this begins at the end of the menstrual phase and lasts for about 8 days. This is when we have kind of a surge of estrogen to secrete, or rather to repair the endometrium. And then the endometrium then thickens back up. And then at the end of this phase, ovulation occurs. The secretory phase is when progesterone is secreted to stimulate continued growth of the endometrium. Um, the arteries and the glands grow and get larger, and then glycogen is secreted in preparation for a fertilized egg. But then, if no fertilized egg shows up, secretion ceases, and then menstruation occurs and kind of starts all over again. So that's why it's called a cycle, because it is cyclical. When a female's reproductive cycle ends, it is termed menopause, and it doesn't pause, it just ceases, okay? But well, sometimes it pauses a little bit and then ceases. This usually starts to occur around the age of 45 to 50. Menopause can take quite a while. For some women, it's kind of done and over quickly. Others, it can take, it's like a process, it takes years. But it generally will start around 45 to 50, some earlier, some later. I have known both. But at that time, the ovarian follicles cease to respond to the FSH and the LH that's being secreted, which then means estrogen and progesterone production starts to slow down. Ovulation eventually ceases. Menstruation eventually ceases. Okay. Once all of that happens, it's over. You can't, a female can no longer reproduce at that point. There are a lot of, accompanying symptoms, hot flashes, primarily hormonal feeling type symptoms. And again, for some women, this is very easy. They never even really notice. It happens quick. Some women, it drags on. Some women, it's a horrible, awful experience. It really just depends on the person, and you can't predict it, unfortunately, how it's going to affect anybody. All right, as aging catches up with us, there is a gradual decline after menopause, reduction in estrogen. I've got that twice, probably meant progesterone. The ovaries start to atrophy, so they start to get smaller. The uterus becomes smaller. The muscle layer is then replaced by connective tissue, so the myometrium isn't really muscular anymore. The vagina can become drier, reduced because of reduction of secretory activity. So things are just not secreting as they once did. And like I said, the reduction of estrogen can then increase the risk of things like osteoporosis and cardiovascular disease, which is why many females that either have a hysterectomy or menopause will choose to go on hormone replacement therapy just to keep those hormones kind of up, so that it, like osteoporosis, is not as big of a concern. Of course, you always want your patients to really think about that and speak with the provider to make sure that's going to be the right thing for them. As far as pathology goes, lots of cancers, unfortunately, associated with the female reproductive system or the female body. Breast cancer. Not that males can't get breast cancer. They can, it's just not as common. Cervical cancer, ovarian cancer, uterine, or what they call endometrial cancer. Ectopic pregnancies. What an ectopic pregnancy is, if you recall, we spoke of the fertilization of the egg generally takes place in the fallopian tube. Well, normally what's supposed to happen after it's fertilized is supposed to continue down that path, end up in the uterus and attach itself to the uterus wall to begin nourishing and growing. Sometimes, and I always just say its GPS is off, and it will actually implant itself in the fallopian tube wall versus the uterine, thinking it's in the right place. And that is not a viable pregnancy. An embryo can only grow just so far into that in that tube before it's going to cause damage. And again, the pregnancy would not be viable, and it's going to cause pain and can also cause a lot of internal bleeding and a lot of other problems too. So that's ectopic pregnancy is not a good thing. Endometriosis is just a condition when the endometrium becomes inflamed, scarred, grows cysts, thickens too much, becomes painful. Um, Common. Endometriosis is common. Mastitis is an inflammation of the breast tissue. Ovarian cysts, very common. These are when you get cysts that grow on the ovaries. It can be very painful. Um, Polycystic ovary syndrome, or PCOS. This is another um, kind of cyst-related syndrome. However, it kind of mimics, ironically, symptoms of diabetes. Um, so there are quite a few females that unfortunately have this issue, and they do kind of treat it with some of the treatments for diabetes. STIs, same types of STIs as males, syphilis, gonorrhea, um, genital herpes, um, and then trichomonas. I can't say this word. Okay, we used to call it trichomonasis. It's basically it's an STI as well, but it's caused by a parasite. I remember when I was in field, we used to pick these up on pap smears a lot. You'd pick up trick on pap smears, you'd see it. It can be treated. It's not a huge deal. It's just not great. Um, but it is quite common. All right. So thank you so much for watching today. And like I said, I think I've only got just a few more systems to wrap up the A&P series. And then hopefully I am going to be able to get some more videos up on skills related topics. And I am also working on something else that I will be announcing soon, I hope. So until next time, everybody have a great day. And as always, like and subscribe. And if you ever have any questions, please don't hesitate to comment in the comment section. If there's something specific you'd like to see from me, put it in the comment section, and I'll see what I can do. All right, have a good day. We'll see you next time.